Okay, so I wanted to comment on the synovial joints and just wanted to show you a little basic anatomy around it. So here you see two ends of bones, right? Here's the uh, distal end of one bone and the proximal end of another bone. And this is the epiphysis, and this is the epiphysis. This is just the distal epiphysis of one bone, and this is the proximal epiphysis of another. And you can see at the very ends of the bones, you've got this articular cartilage here in blue. And articular cartilage contains articular cells or cartilage cells. And cartilage cells can regenerate. And the way they regenerate is they get their nourishment from this synovial fluid, right? So here's the synovial membrane, right? And it creates this joint capsule or articular capsule along with some of these ligaments on the outside that help contain it. But inside here is the joint cavity with the synovial fluid. And the synovial fluid circulates and moves when you move the joint. So as the joint is moving, let's say it's your fingers or the shoulder joint or the hip joint or the knee joint, each time the joint moves, it circulates the synovial fluid, which then nourishes the cartilage cells, and the cartilage cells can regenerate. If the cartilage cells are not regenerating, then they are degenerating, right? And that's what degenerative joint disease is, or osteoarthritis. So it's really important to keep the joints moving so the synovial fluid circulates so that the cartilage cells can get their nourishment. Remember, cartilage doesn't get nourishment. It has a very, very poor blood supply. Doesn't have any blood supply, really. So it's getting all its nourishment from synovial fluid. You can get it through diffusion of the adjacent structures like muscles and tendons. It can diffuse, but very poor blood supply. So it relies on the synovial fluid to bring all the nourishment to the cartilage cells. And that's why it takes a little bit of a long time when people supplement with, let's say, MSM or glucosamine chondroitin sulfate. Patients may not experience relief within the first few weeks or first month or even through the first bottle of that supplementation, because it takes a while to diffuse and get into the synovial fluid, which it can then nourish and act as the rebuilder for those cartilage cells. It's really important that the nutraceuticals that are used are high quality, and that the ingredients within that nutraceutical is supportive and works symbiotically to increase the absorption rate of those nutrients. Okay, it's a real science to it. But it also helps us understand why certain exercises are better than others for people that do have degenerative joint disease. If there's destruction in here and bony articular changes or osteophytes or bone spurs, then sometimes weight-bearing movement becomes very difficult, and that's where aquatics come in, right? If you're in a pool, you're not feeling the effects of gravity, and you can move and circulate all the joints. That's why it's so very beneficial. Okay, so hopefully you learned a little bit more about the synovial joint, synovial fluid, and making some connections between the synovium and the synovial fluid with health and the musculoskeletal system and exercise and arthritis. Okay, and DJD, degenerative joint disease, and rheumatoid arthritis will both affect these joints just a little bit differently, and the causes are a little bit different, but that's for another video.